Hi guys, my name is Bobbie and I'm here today to talk to you about the importance of colon cancer screening and how it can save your life. It is estimated by the American Cancer Society that 136,000 people will be diagnosed with colon cancer in 2014 alone. And of those diagnosed, at least 50,000 of those individuals will die. The lifetime risk of developing colon cancer is about 1 in 20, but individual risk factors can increase that number. As a nurse in the GI office, we see patients routinely who have digestive complaints that are not related to their colon. However, it's very important, and we ask each and every patient, especially age 50 or older, if they've had a colonoscopy, and if they haven't, we do get them scheduled for that because that is how important screening is. I spent 6 years of my nursing career in the endoscopy suite, where we would also do something called colon clinic, and that means that you're 50 years old, you're not having any signs and symptoms of any kind of digestive issues, but it's time for you to get a colonoscopy. So one of my first patients after orientation was 50 years old. She was healthy, non-smoker, non-drinker, exercised regularly, did everything she was supposed to do, but because she had turned 50, came in for a colonoscopy. It was found that she had a cancerous tumor in her transverse colon that day. After that, we sent her on to a surgeon and an oncologist. She had a successful colon resection as well as chemotherapy and radiation treatments, and came back 1 year later for surveillance colonoscopy to get the awesome news that she had been cured of colon cancer. That is how important screening is. Colon cancer statistics, as briefly mentioned, the number of patients who may develop colon cancer in 2014, but colon cancer is the third most commonly diagnosed cancer and the second leading cause of death in the United States alone. 90% of cases and deaths from colon cancer occur in people aged 50 years or older. However, cancer does not discriminate and it can occur at any age. The 5-year survival rate for colon cancer found at the local stage, which means that's a polyp within the colon, is 90%. The 5-year survival rate for cancer found at the regional state, which means there's some involvement outside of the colon, is 70%. And then the 5-year survival rate for cancer found at the distant stage, where it involves other organs and lymph nodes, is 12%. The majority of colon cancers do begin as a polyp, which is a growth that begins in the lining of the colon or the rectum. And only certain types of polyps develop into cancers, and those are called adenomas. Currently, there is more than 1 million colon cancer survivors in the United States, and I think that that's an awesome number. So let's take a look at some signs and symptoms of colon cancer. The most common sign is rectal bleeding, dark stools, or the appearance of blood in the stool. However, you could also have change in stool caliber or consistencies, change in bowel habits like diarrhea, constipation that lasts longer than several days. Also abdominal pain, cramping, unattended weight loss, weakness, fatigue, nausea, vomiting. Those are also some indicators that could lead to colon cancer as well. Colon cancer is detected through colonoscopy, so I kind of like to walk you through that process. The day before a colonoscopy, you do have to be on clear liquids because it's very important to be able to clean your body out. In my office, currently, clear liquids include water, coffee, tea, sodas, juices, Gatorade, Jell-O, soup broths, anything that's not solid and not a milk or dairy product and doesn't contain any red dye, because red dye can look like blood as your body breaks it down. It's also very important that you avoid non-steroidal anti-inflammatory medicines like aspirin, Advil, Aleve, Motrin, Excedrin. Those types of medicines can increase the risk for bleeding, which puts you at an increased risk if you have polyps removed. The evening before the colonoscopy is when you start drinking your bowel prep, which is a huge jug of electrolytes, but it works in the same manner as a laxative, so the patient will have diarrhea. While it's unpleasant, it's very important to complete the prep so that you have the best colon clean out so the endoscopist can see exactly what it is they're looking for. You don't want any polyps left behind in the event that they could develop into cancer eventually. So what happens if we remove polyps? So if a polyp is removed, then it gets sent to pathology to be looked at under the microscope, and it takes about 3 days to get those results back. Once they're reviewed, then we notify the patient. Some polyps are hyperplastic, which means that they're 100% benign, and you can wait another 10 years before you have to go through with another colonoscopy. Some people have precancerous polyps called tubular adenomas, which means had they been left in the colon, they had a 10% chance of growing into cancer over the course of years. So those people need to come back in 3 to 5 years to have another screening colonoscopy. If a tumor or cancerous mass was found, then usually a CT scan is obtained to make sure there's no involvement in other organs or lymph nodes, and then the patient gets referred to a surgeon or an oncology so that together that team can figure out the best plan of care for the patient to maximize life expectancy. So to wrap it up, colon cancer is one of the most common diagnosed cancers, but can be one of the most curable cancers. And signs and symptoms, again, rectal bleeding, weight loss, dark stools, weakness, fatigue, abdominal cramping. And while the preparation for the colonoscopy itself is unpleasant, it's a very important thing to be able to detect the polyps, to remove them, to save your life. And basically the whole point of this is to save your life one colonoscopy at a time. I have witnessed it firsthand, and I know a lot of other patients who we've saved their lives just through routine screening colonoscopy alone. So I hope that you have enjoyed this information and that you can take this and use it and tell your family and friends about the importance of colon cancer screening. Thank you and have a great day.